Hi, this is Dr. Greg Oliver at Fat Doctor TV once again. Today we're going to talk in detail about some of the things we talked about last week. We talked about the four components of our body, and that included our physical nature, it included our emotional nature, our mental nature, and our spiritual nature. Those are all important in getting healthy, and they are important in losing weight. So today let's focus on our physical body. Now, our physical body includes all the chemical reactions that are going on in our brain, that are going on in our tissues, our organs, includes our blood sugars, includes all of our electrolytes and proteins and calcium levels, blood count, all those types of things. So let's say you're ready to start losing weight. You've got 20, 50, 100 more pounds that you want to lose. So the first thing to do is take a look and focus on your physical body. And you're probably not going to be able to do all this yourself. You will need to see a physician or healthcare provider to do this. But the first thing you want to do is to make sure there's nothing physically wrong with you that's causing you to retain or to gain weight. Now, I have a lot of patients who come in and say, Doc, I don't really eat a lot of food, but I can't lose weight. There may well be something wrong. There could be a problem with hormones. There could be a problem with their thyroid or their adrenal glands. There certainly could be a problem in their ability to process carbohydrates in the liver, or a storage problem with carbohydrates. It could also be what I call carbohydrate addiction, which is a very specific problem in the brain, where our brain has a certain pathway where carbohydrates increase certain chemistries in the brain that make us want to eat more. And these types of things in the body can be measured. We can measure the blood sugar, we can measure the blood count, we can measure the hormones. It's very important, if you're going to measure thyroid, to measure not just the TSH, and I'll explain that. TSH is from the brain, the pituitary gland, that tells our thyroid gland, which sits at the base of our neck, how to work. All right? Now, if your thyroid level is low, the TSH is high, because the brain is trying to tell the thyroid gland to make more thyroid hormone. However, there are two thyroid hormones. There is the T4 hormone and there is the T3 hormone. Our T4 hormone is actually what's manufactured by the thyroid, but it has to be converted into T3. So we need to know that our T3, which is the active thyroid, is elevated, is high, not too high, but in the higher range of normal. If it is not, your metabolism will be low, you'll be sluggish, you'll gain weight, you'll hold fluid, lots of things like that will happen. We also know that in some people, for certain reasons, maybe they've got too many heavy metals in their body or some toxins in their body, they will convert their T4 into what we call reverse T3, and that is not an active form of T3, which is our thyroid. So I know this may sound complicated going, well, I don't know, T4, T3, reverse T3, and TSH, but I want to give you some very specifics, especially about thyroid, and that is you need to have these measured. And if you go to a doctor and they just measure the TSH, that's not adequate enough. We need to know your total T4, your total T3, and your reverse T3 so we can figure out what the problem is and get it corrected. Now, if your thyroid's normal, we need to look at things like adrenal function to make sure that your adrenal glands are active and performing properly. If your adrenal glands are putting out too much cortisol, and you all know cortisol is a precursor to cortisone. If you make too much cortisol from your adrenal glands, you're going to hold on to too much fat. You're not going to burn the fat properly. Why would you put out too much cortisol from your adrenal glands? Well, the number one reason is stress. So if you're under stress, that has to be corrected. You cannot lose weight if you're in a high stress situation. I get people all the time that come in and say, you know, I'm in a horrible job, I don't like my boss, they're always on my case, I go in the door at work and I'm stressed all the time. You're going to have trouble losing weight, and that needs to be dealt with, whether we treat the stress or we support your adrenal glands or both. That needs to be done. So that's another physical aspect of weight loss that has to be dealt with. Another issue I mentioned was carbohydrate intolerance or semi-addiction. And how do we treat that? It has to be aggressively treated by dropping carbohydrates dramatically. And I use medication to assist the brain in not wanting the carbohydrates so much. So those medications could be topiramate or zonisamide. Sometimes we'll use an herb called Gymnema sylvestre. These are very specific treatments that can be done. So check with your physician, see if they're willing to look into these matters, see if they're willing to treat you if you have them. If not, then I encourage you to find a physician who will do that. And that won't irritate your normal physician because maybe they just don't know that or don't deal with this type of treatment. But you can certainly find someone out there who can treat that. If you can't find someone, send us a note here at Fat Doctor TV. We'll dig into our files and see if we can find someone in your area that might be able to help you. So, in the future, like I say, we'll go into some more details, but that'll be enough for today. I've kind of nailed you with the thyroid, the adrenal glands, and addiction in the brain. We'll talk to you next time on Fat Doctor TV, and get some treatment. Bye now.